Now, after delivering the placenta, you look at the placenta. You look at the placental cotyledons. You evaluate if all the cotyledons are there. Normally, there should be 16 to 20 cotyledons of the placenta. Normally, the placenta is made up of two parts. You have the fetal side and you have the maternal side. Is it clear? The maternal side. The fetal side is going to be made up of the jelly-like substance. A jelly-like substance called the Wharton jelly. Is it clear? It's made up of a jelly-like substance called the Wharton jelly. While the maternal side is made up of a reddish part made up of blood vessels and cotyledons. Blood vessels and cotyledon. And that cotyledon is what you are going to evaluate. It should be 16 to 20 in number. Now, after evaluating for the placenta cotyledon, you do now a uterine, you palpate for the uterus, uterine palpation to evaluate if there is uterine contractions. Is it a uterine palpation to evaluate if the uterus is globular? Is it clear? Globular and firm, globular. Is it clear? So we evaluate if the uterus is contracting. If the uterus is not contracting, now we need to massage the uterus for uterine contraction. Now, after the palpation of the uterus, we evaluate if the uterus is not contracting. You now have the next one after the palpation of the uterus. We now have to evaluate for any perineal tear. Is it clear? To evaluate for any perineal tear. Normally, the evaluation of perineal tear has to be done with a vaginal speculum examination. Is it clear? You have to evaluate for perineal tears with vaginal speculum examination, or you can leave the patient there to find if there's any signs of postpartum hemorrhage. And then the ninth one is that you evaluate for the blood of the patient. Evaluate for the blood of the patient to see if it is coagulating. Is it clear? To evaluate if there is any coagulopathy, which can be a complication of, which can be an etiology of the postpartum hemorrhage. Is it clear? So those are the different elements of in the third stage of labor, how you have to manage your patient. Now, the next thing is how you manage your patient in the fourth stage of labor. So in the stage 4 of labor, the management of stage 4 of labor is just monitoring. Is it clear? You need to do a postpartum monitoring. Is it clear? In the fourth stage of labor, and the monitoring has to be done for the first 2 hours. Now, what do you monitor? What are the elements that you have to monitor in postpartum monitoring? You need to know that there are going to be different postpartum complications that can occur. Is it clear? You can have one. What are the postpartum complications that you have? You can have postpartum depression and postpartum psychosis. 2, you have postpartum preeclampsia, and you have postpartum eclampsia. Is it clear? Number 3, after postpartum preeclampsia and eclampsia, you can have also you have postpartum breastfeeding related complication. Postpartum breastfeeding related complication. Is it clear? Like the breast engorgement, the mastitis, the cracked nipples. The fourth complication of postpartum that you need to know is that you can have postpartum thrombosis. Is it clear? Postpartum thrombosis in the case of deep venous thrombosis, because after the pregnancy associated with the formation of high numbers of clotting factors, it can result to deep venous thrombosis and all that, postpartum thrombosis. The fifth element after postpartum thrombosis, you can have also postpartum pains. Is it clear? When you can have postpartum pains, like in the case of postpartum after pain. Is it clear? So you can have postpartum pain. The sixth element, you have postpartum sepsis. When you have any infections like postpartum endometritis, any other infection that can occur in postpartum sepsis. The seventh element after postpartum, you have postpartum perineal trauma. Postpartum perineal trauma. Is it clear? So those are the 7 postpartum complications that you must note. Now, postpartum depression cannot or you do not usually occur during the first 2 hours. Is it clear? During the first 2 hours, you don't usually have postpartum depression. It occur from weeks to months. Is it clear? From weeks to months. So the other one, that's why the postpartum period, when you want to do postpartum rendezvous, is it clear? Postpartum rendezvous, it is the rule of the first 6, the second 6, and the third 6. Is it clear? The first 6 is going to be 6 days after delivery. Is it clear? So 6 days after delivery, you have to give rendezvous to the patient. 6 days after delivery, delivery to evaluate for other postpartum complications. The second 6 is 6 weeks after delivery. Is it clear? 6 weeks after delivery, you have to evaluate for postpartum complication. Then the next is for 6 months after delivery. Is it clear? To evaluate for other complication. Sometimes doctors also add another 6 first year, which is 6 hours after delivery, because there are other complications that can occur within the first 6 hours. So knowing the different complications, you can know how to monitor the patient. Is it clear? The first 6 is sometimes 6 hours after delivery, but usually the first is 6 days, 6 weeks, and 6 months. But some doctors also add 6 hours. Now, within the first 6 days, is it clear? Within the first 6 days, which type of postpartum complication you can have? 6 days to months, you can have postpartum depression. Postpartum preeclampsia usually occur within the first 6 hours. Is it clear? Within the first 6 hours to 6 weeks, you can have postpartum preeclampsia, eclampsia. Is it clear? Within the first 6 hours to 6 weeks, postpartum preeclampsia to eclampsia. Within the first 6 days to 6 months, is it clear? When the mother is breastfeeding the child, you can have postpartum breastfeeding complication. Is it clear? Within the first 6 days to 6 weeks, you can have postpartum thrombosis. Is it clear? Provided the patient, that's why the patient has to mobilize. She has to mobilize in order to prevent those deep venous thrombosis and pulmonary embolism. Within the first 6 hours to 6 days, or the first 6 hours to 6 weeks, the mother is going to have postpartum pain after pains, because there is pain. When the mother is breastfeeding the child, you are going to have the reflex action. Is it clear? That way, that is going to result to oxytocin production, and oxytocin is going to result to uterine contraction, causes pain. Is it clear? And that causes the postpartum after pain, which you can relieve just by giving the patient as paracetamol. Now we have postpartum sepsis. Postpartum sepsis usually occur within the first 6 hours to 6 weeks. Is it clear? 6 weeks is even too much. We have it's something like 2 weeks, because at the level of 2 weeks, we have the closure of the cervix. The cervix is already completely closed by 2 weeks to 6 weeks. Is it clear? So the postpartum complications from 6 days, from the 6 hours to 6 weeks to 6 weeks, but the peak is going to be less than 2 weeks. Is it clear? For postpartum sepsis. Now for postpartum trauma, you have now is you can evaluate it immediately. Is it clear? You can evaluate it immediately within the 2 hours to 6 hours. Is it clear? Now for going to another postpartum, you have postpartum postpartum hemorrhage. Is it clear? Which another postpartum complication. And postpartum hemorrhage can be evaluated within the first 2 hours to 6 hours. Is it clear? We can have even other prolonged postpartum hemorrhage, depending on the type of postpartum hemorrhage that we have. Is it clear? Postpartum hemorrhage can be divided into immediate, early, and late. Is it clear? Postpartum hemorrhage, or you can just say early and late. Early is within the first 24 hours. Is it clear? Which can be seen mostly within the first 2 hours and within the first 6 hours. While late is going to be late postpartum hemorrhage is going to be in the next 24 hours. That's late postpartum hemorrhage. Is it clear? But immediate postpartum hemorrhage is when you have it within the first 2 hours. Is it clear? When you have postpartum hemorrhage within the first 2 hours, it's going to be immediate. So those are the different things that you need to evaluate when you have a patient that is in labor. Now we are going to now see the next point.